And then October, November 2021, I get alerted from a cardiologist friend of mine who's one of the smartest cardiologists in the country, I think. I mean, he's a brilliant mind. And he sends me an abstract from Circulation, Cardiology Journal, done by Stephen Gundry, who's a cardiothoracic surgeon, I think, based in New York. And I read this abstract, and I'm like, wow. And what he found was he'd been following up several hundred people in their 50s with a test that he does called the pulse score, which correlates the blood test, and it measures markers of inflammation in the blood, Joe, which have been validated and correlated with heart disease risk and heart attack risk. And what he found was that within 8 to 10 weeks of these patients taking the Moderna or Pfizer vaccine, mRNA vaccines, those markers of inflammation in the blood had increased to a level where their risk of a heart attack went from 11% at 5 years, just within 2 months, to 25%, which is a huge jump. Like, to give it context, if I today decided I was going to smoke 40 cigarettes a day, eat junk food, hammer it all night, not sleep, stop exercising, I couldn't even get it close to increasing my risk that much in 2 months. Now, it's one bit of data. And of course, in medicine, which we've talked about, is not an exact science. You never rely just on one bit of data. You look at other bits of data as well. And what kind of picture does all the information start painting? Then what happened was I got contacted. It all happened within a few weeks. A journalist, I think it was from the Telegraph or the Times, I can't remember, asked me to comment on the fact there'd been an unexplained increase, about 25% increase in heart attacks in Scotland in hospitals that people can't explain. So they said, Dr. Malhotra, what do you think's going on? And then the third thing that happened was I was a whistleblower from a prestigious university in the UK contacted me, cardiologist, and he said to me, he was very upset. He said, Aseem, something I've got to tell you. I don't know what to do, but I need to tell you this. I said, what is it? He says, this research group had accidentally found, with the use of coronary imaging techniques, so this is specialized high-tech scans of the arteries of the heart, that in the vaccinated, there was increased inflammation of the arteries of the heart, and it wasn't there in the unvaccinated, which again would increase heart attack risk. But they had a closed meeting and they said, we're not going to publish these findings or talk about it further because it may affect our funding from the drug industry. And at this stage, Joe, I was like, okay, now I've got 3 bits of data. There's enough here for him to at least ask the question. So I got on one of the more semi-mainstream news channels in the UK is called GB News. And I went to them. I said, listen, something I want to talk about. I said, I'd done stuff with them before. And they said, come on, let's talk about it. So I talked about this. It went viral, And I didn't say stop the vaccine or whatever else. I said, listen, there's a signal here that needs to be looked into. We've got these unexplained heart attacks happening. We've got this evidence from Circulation. I've been told by this whistleblower. Let's look at this a bit further. And what happened then was just so bizarre. It was almost around the same time. I don't know if it was, maybe it may have been just after that, Joe. Our Secretary of State for Health, Sajid Javid, gets up in Parliament and says, I've decided we need to pass legislation to ensure that all healthcare workers get vaccinated. And if they don't, they lose their job. Now, we've never done that in this country. I know you've had maybe mandates for other things. We never mandate any medical intervention in the UK. We've never done that before. I thought, this is odd. I said, right now, first and foremost, by this stage, Joe, we knew it wasn't stopping transmission, right? It probably wasn't going to stop infection either. The narrative kept changing. We were told it was going to stop infection. Now it's going to prevent you having severe disease. It kept changing. I said, this should be an individual choice now. There's no, healthcare workers are not protecting their patients by being vaccinated. They may be protecting themselves. We'll get onto that data shortly. But they're not protecting their patients. Therefore, there's no reason, we shouldn't mandate this. So then I literally launched into this. That's what people really want. And people ultimately, they want access to the truth and they want to do the right thing. They hate to see injustice. So we keep making the injustice visible and we will win this.
I don't know if you're aware of this, but there was I believe it was a Facebook post where I don't remember what organization put it up, but it might have been a news organization. It was, do you know anyone that died from COVID? Like, what are your stories of people who died from COVID? And then underneath it, people started posting all their loved ones that died from the vaccine and all their loved ones that had debilitating injuries from the vaccine. And it was a massive post. It was thousands and thousands and thousands of comments. Obviously, unverified, anecdotal. You don't know what, I mean, it could be all disinformation. Who knows? But the shock of seeing that printed, and this was early on. This was when people were still very much on the narrative that the vaccine was getting us out of this, the vaccine was safe and effective, and only fools and conspiracy theorists were willing to risk their lives and not participate. And it was pretty stunning. That feeling I get, that's the same I get from conversations with people where they tell you about their uncle, their friend, their this, their that, their brother, their son. They tell you about these injuries, and then they tell you about the struggles of getting people to connect them to the vaccine. They talk about how they've tried to get it in the VAERS report and the unsuccessful attempts to do that, even though the VAERS report is pretty extensive with vaccine injuries. It's the whole thing seems like there's a lot of people that don't want to talk about it but have stories and feel very fucked over.